ये क्या है डालिए।
Good afternoon, madam.
Good
Namaste.
afternoon. Good afternoon. Good afternoon, everybody.
Thank you. वजह से A very good afternoon.
Good afternoon.
Yeah, welcome you all to the 35th webinar series on raising cancer awareness. When we speak about cancer, the cancer is a major cause of morbidity and mortality worldwide. It poses a great challenge in its prevention and control. There are many myths with run around cancer treatment. To mention a few, we can say cancer means death. Cancer treatment is very costly. It is not affordable by the general public. And the treatment is very painful. Cancer can never be cured. Even if it is treated, it reappears. All the cancers are same. And few think that cancer can be contagious. In a statistics by WHO, they have found in the year 2020, almost 14,61,424 individuals in India are affected by cancer, which means the cure rate is 104 per 1 lakh, or to be very precise, we can say it as 1 in 9 people are likely to develop cancer in India. So it is the major hot topic, and that is the reason why WHO is remembering the month of February as Cancer Awareness Month. And in this webinar, we have Dr. Professor Neelam Mishra, the Vice Chancellor of Krishna Vishwa Vidyapith, Kharat, Maharashtra, and our Honorable Vice Chancellor, Dr. Subhash Chandra Parija, to address on 2 topics. The first session will be on cancer awareness programs and attitude towards cancer screening. The second session will be on cancer awareness and self-examination practice among general public. Let me introduce the first speaker of the day. Our first speaker is Professor Neelam Mishra, the Honorable Vice Chancellor of Krishna Vishwa Vidyapith, Kharat, Maharashtra. Madam is an academician par excellence, having a total teaching experience of over 34 years, including postgraduate teaching. Madam happens to be the first lady professional in the state of Maharashtra to be appointed as the Pro Vice Chancellor of a statutory university. Madam is designated as IMA Honorary Professor by the IMA New Delhi and is also conferred with the title Professor Emeritus by Bareilly International University, Uttar Pradesh. Ma'am has been conferred with the National Women Empowerment Award instituted by National IMA Women Doctors Wing, New Delhi in the year 2018. Madam has been confirmed with Samaj Ratna Saman 2015 in recognition of the service rendered by her. She has an outstanding teaching and has conferred with Priyadarshini Award in recognition of devoted services as committed medical teacher and selfless mentor on 2016 in the name of the late Prime Minister, Ms. Indira Gandhi. She has been designated as a chairperson for the National Head of Allied Science, Bioethics Program and UNESCO. Madam has many national and international publications to her credit. She has guided and carried out several research projects and is also a doctoral degree program in the stream of physiology as well as interdisciplinary science. Recently, Madam has received the honorary fellowship by Association of General Practitioners, Indian Medical Association 2019. We welcome you, Madam, for the talk. Over to you.
I want to share my slides. Can I share my slides?
Yes, please, Madam.
Bismillah. Yes, everybody can see my slides?
Yes, it's visible, Madam, please.
So my topic is cancer awareness program and attitude towards cancer screening. A very good afternoon to all the respected persons present over here as well as on virtual mode. Myself, Dr. Mrs. Neelam Ved Prakash Mishra, Vice Chancellor of Krishna Vishwa Vidyapeeth, Karad. I am going to deliver a guest talk on the topic as shown in the previous slide. Before starting about the slides, I want to say a few words, that is non-communicable diseases, that is NCD. About the centers or these programs, NPCDCS, that is National Program for Control of Diabetes, Cardiovascular Disease and Stroke. For this, the NCD cells are being established as national level, state level and district levels by the government for early diagnosis. During 2010 to 2012, program was implemented to 100 districts across 21 states. For common, or you can say for cancer component, this tertiary care cancer center, TCCC, tertiary care cancer center, which aims at strengthening of state cancer institute, was established. On March 2016, program is under implementation in all 36 states. During 2015 to 16, more than 1.29 crore persons have been screened in designated NCD clinics, of which 8% found to be diabetes, 12% hypertensive, 90,000 with cardiovascular disorders, 13,000 with common cancers like oral, cervical, and breast. During 2015 to 16, around 96 lakh persons were screened under various outreach activities for common NCD in camps or PHC or SC, and they were referred to higher centers in diagnosis and management. So this was about the programs. Now I'm starting with my first slide. Cancer awareness is the key to earlier detection and better health seeking behavior. Cancer is quite common in both developing as well as developed countries, but awareness is yet poor among the general population. Cancer is a global disease and is spreading rapidly. In low middle income countries, patients with cancer generally have a poor prognosis as compared to patients in high income countries. Reason behind this is, first is lack of awareness, number 2, late diagnosis, number 3, inequitable access to affordable curative services. This lack of awareness leads to the late reporting of cancer cases to healthcare facility. Importance of cancer awareness is to ensure behavior that facilitates early detection. Absence of cancer awareness seen as detriment to this end. Delay in health seeking is attributed to the factors illiteracy, financial constraints, myths, superstitions, and lack of awareness. Screening is an important preventive measure in cancer control. National program in India has a screening component, but yet to take roots in most part of the country. At present, most of the screening tests are available at higher centers only, and available screening methods to the population are not properly adequately utilized. Need to understand the attitude of people towards screening practices. There is need to synthesize a review on cancer awareness. Cancer awareness is associated with many factors beside literacy rate, one of which is income level. High income group participants have better knowledge than that of low income group. In a study by Reddy et al., low level of awareness is also associated with low educational qualification of the study participants. In India, lip and oral cavity cancers are currently more common. Awareness about this can be related to advertisements and warning signs of cancer in the tobacco packets. Awareness of cervical cancer is poor among Indian women. Breast cancer is the most common cancer among female in the world and India. Level of awareness about breast cancer is overall good as compared to cancer cervix. Here also educational level matters. Reasons, danger signs of breast cancer are more appreciable than cancer cervix. widespread publicity about breast cancer through mass media, socio-cultural aspect of stigma and not talking about genital areas in Indian milieu. A study by Elango Wen et al. Demonstrated that positive association is there between awareness about curability of cancer and increase in educational status. Though people know about cancer, but about curability aspect, substantial gap is there. Awareness level of preventability for cervical cancer in a study by Ray Chaudhary et al. Was found to be very low. Awareness about risk factors of cancers. First, limited to tobacco and alcohol. Though people are more aware about this ill effects of tobacco and alcohol. Number two, awareness level about smokeless tobacco is a risk factor and found 74% by Puri et al. Study. Alcohol and radiation is another factor. In case of breast cancer, family history is important. In breast cancer awareness, a study done by Dahiya et al., where 48.6% were aware of mammography as screening method. So only 48.6% were aware of mammography. That is an investigative procedure. Study by Siddhartha et al. Found none knew about self-breast examination in a hospital-based study in central India. Petra et al. Study found only 1/4 of the participants willing to participate in a cervical cancer screening. Screening practices of cervical cancer with pap smear was much less, 2.4% in an Indian study by Sabina et al. So general awareness of cancer in India is poor. Also poor awareness about curability, preventability, and screening methods. For this, education and the place of residence, it matters, whether rural or urban, it plays a vital role. Screening practice can be improved by community level awareness. So community level awareness plays a major role. Cervical cancer is second most common cancer or cause of mortality in India, 1/5 of the world incidence. Awareness and health seeking practices are poor in developing countries. There is necessity for awareness program with improvement cancer technology. We can improve quality of life by improvement in survival, but improvement in survival is still questionable. In India, late presentation is because of many factors: lack of knowledge and awareness, lethargic attitude towards safe health practices. After a study among school teachers in India, facts came forward are: this was a part Pink Chain campaign in the mission of which is to fight against and cure the spread of cancer. This is from a paper in American Society of Clinical Oncology, author is by Abhishek Shankar et al. The study was done at women's colleges in different states of India. Participants were 186 teachers. A pretest of knowledge and attitude and regarding the practices related to cancer cervix was conducted by questionnaire. Pretest and post-test was done after proper explanation of the study to the teachers. Pretest was followed by awareness program, that is lectures by oncologists working at medical institutions on preventive aspect of cervical cancer with an interactive session. Pink Chain campaign also started awareness about other common cancers, that is breast cancer, cervical cancer, lung cancer, head and neck cancers from the same platform. Literature related to cancer awareness was sent regularly every 3 months for 1 year to email addresses. So all the 186 teachers of college, they were sent regularly regarding the reading material regarding the preventive aspect of cancer every 3 months. After 6 months and 1 year, the same questionnaire was mailed to the participants' email addresses provided, and 88.5% was overall response rate. They were asked about smoking and alcohol consumption. Some who smoked and consumed alcohol before the campaign, changes in smoking and alcohol consumption were noted at 6 months and 1 year. Decrease in frequency in smoking was 11%. For alcohol, frequency was decreased by 16%. And at 1 year, 21% quit smoking about the ladies I'm talking about. 43% quit consuming alcohol. There was a significant change in smoking and alcohol habits. Pre-test and post-test shows very significant results. Source of knowledge regarding PAPS test. 75% educated by physicians regarding the PAP test. So education was through the physician. Reasons for not undergoing a screening test was 83.5% ignorance, 29.3% lethargic attitude, and 10.9% lack of time. Most of the women are unaware of the risk factor for cancer of cervix, and similar findings were noted in another study. In developing countries, important risk factors are smoking, long-term use of oral contraceptive pills, poor genital hygiene, multiple sexual partners for cancer cervix. So these are the risk factors for cancer cervix. And symptoms for cancer cervix are bleeding during or after sex, vaginal bleeding during sex, menopause, vaginal bleeding during menopause, pain during sex, persistent low back pain. Pap smear test was known only to 35% teachers in this study. Findings in this study suggest lethargic attitude, economic barriers, time and money availability, fear and hesitation. So there is need to overcome psychosocial, institutional, and access barriers that perpetuate health disparities. So this was about the Indian study. Now I'm forwarding another study, an article by Heather Jean in USA. In this, the people living in USA, the studies was done on them. 2/3 of deaths due to tobacco use, due to poor nutrition, due to physical inactivity and obesity and alcohol abuse are entirely preventable. Skin cancers can be prevented by avoiding overexposure to sun. Cancers related to viral or bacterial infections such as hepatitis B, virus HPV, human papillomavirus, HIV, and Helicobacter can be prevented through changes in lifestyle and use of vaccines or antibiotics. Greater use of screening can decrease the deaths related to breast cancer, colorectal cancer, uterine cancer, cervical cancers. Pap smear, mammogram, and screening. Pap smear for cervical cancer cervix, mammogram for breast cancer, and screening for colorectal cancer is must. A recent analysis of 2005 from NCI documented that most Americans are aware of cancer screening modalities, but unsure of the age at which they need to implement these screen tests. So this was about the study. Now I'm proceeding forward for what is APN, role of advanced practice nurse. To educate this advanced practice nurse with the graduation and post-graduation in nursing, they are having extra training for this cancer aspect. They have more, they are trained accordingly. They are capable of to educate their patients and public regarding recommended cancer risk reduction and screening guidelines by helping and diagnosing cancer at the earliest possible stage. How to do this cancer risk assessment? So cancer risk assessment is a vital part of oncology. APN's role in cancer prevention and early detection is must or is important. Evaluation of patients' risk for cancer based on a variety of both intrinsic and extrinsic factors and begin with a detailed history. Here, history components, the past history, first of all, it is very important. And then regarding the medical history, all the points should be covered. Then obs and gynec history is important. The surgical history is important. And documentation of age, appropriate screening test, this is also important. Regarding the family history, 3-generation pedigree. So all the 3 generations, whether any person in the history has, in the family have suffered from cancer. Medical history, any history of hormonal use. Dietary history, non-veg or veg, whether the person is taking properly fruits and vegetable proper amount or not. The level of physical activity, whether it is having sedentary habit, that we have to know. Environmental exposures, this is also important factor. And history of alcohol and tobacco use, we should also see. Other lifestyle So cancer risk assessment, for this, a thorough physical examination concludes the cancer risk assessment and includes a breast, pelvic, rectal examination. Some cancer assessment tools and models are also available, but they are having their own strengths and weaknesses. Scores are calculated based on a variety of risk factors, including age at menarche. Non-medical person, I have requested some non-medicals also to attend. So menarche means at which the menses starts. Age at first live birth, race, number of first degree relatives. Immediately first degree, your mother, your sister, your sister-in-law, and like this first degree relatives, if they have suffered from breast cancer, that is also important. And number of previous breast biopsies. Cancer risk assessment, example, breast cancer risk, lung cancer risk, cancer gene software assessment tools are there. From University of Texas and NCI, about tools, they can be used by advanced practice nurses to best estimate and counsel patients on cancer risk and interventions to decrease that risk. Now we are coming to primary prevention and risk reduction. Primary prevention is including smoking cessation interventions, chemoprophylaxis in women with at high risk for breast cancer. Secondary prevention is including screening and early detection at earliest possible stage. Tertiary detection is including where the cancer is diagnosed. And now early detection of secondary malignancies is required. Important is tobacco use, smoking cessation, sun exposure, diet, and exercise. This also we have to see. What is chemoprevention? That is use of whatever the chemoprophylaxis that is asked, or that is we have to follow in patient. Induction of cell apoptosis. What is the meaning of apoptosis? Cell death. So induction of cell apoptosis or inhibition of cell growth. This is by the chemoprophylaxis. Here, some has been approved for prevention of prostate cancer, colon cancer, and breast cancer. Not for lung cancer and skin cancer. Side effects are more. So this medicine, this tamoxifen and loxifene, this is for the estrogen receptor positive breast cancers. And it's having its side effects. Its use is individualized because of its side effects. Side effects include thromboembolic events and endometrial cancer. So for breast cancers, age between 20 to 40 years of age, advised is clinical breast examination every 1 to 3 years, and breast self-examination periodic is recommended. For women 40 years above 40 years of age, annual mammogram, MMG, and clinical breast exam and periodic breast self-exam are recommended. Modifiable risk factors which we can modify are: first is recent oral contraceptive use or hormone replacement therapy. Now, number 2, nulliparity or first childbirth after the age of 30. This can be modified. Third is post-menopausal obesity, sedentary lifestyle, alcohol control, and diet control. Diet should be rich in fruit and vegetables. Now, the irreversible risk factors are female gender, Caucasian, advanced age, inherited genetic mutation, it is breast cancer 1 and 2. These are, you can say, mutation of the gene, hereditary mutation of genes are there in this. Personal and family history of breast cancer, atypical hyperplasia, and other benign breast lesions, history of high dose radiation to chest in case of Hodgkin lymphoma, early menarche, and late menopause. This is about the USA study we are seeing. So we come across colorectal cancer. It is the second leading cause of cancer death in USA. Colon cancer more common in females. Rectal cancer more common in males. Reason and modification are needed. Needed changes are physical exercise, fruit and vegetable intake should be increased, sigmoidoscopy every 5 years, and full colonoscopy every 10 years. Regarding prostate cancer in USA, in American men, most commonly diagnosed. For this, digital rectal examination is advised. It detects prostate cancer in its earlier stage. Endometrial cancer, it takes place in 6th or 7th decade of life. Risk factors are unopposed estrogen exposure and reproductive history. Risk factors include polycystic ovarian disease, anovulatory ovary disease, early menarche, late menopause, irregular menses, infertility, nulliparity, advanced liver disease, hypertension, obesity, diabetes mellitus, family history of endometrial cancer. Ovarian cancer is the risk factors again, nulliparity, continuous ovulation. And here we can mention this breastfeeding and contraceptive oral and multiparity have protective effect. Regarding skin cancer, in USA, they are taking artificial tanning bed for tanning. So this skin cancer can take place because of excess exposure to sun. And for protection, sunscreen one must use. The lung cancer, high-risk individuals are the smokers and the occupational exposures. Screening recommendations. Other cancers are bladder, urothelial cancer, esophageal, gastric, hepatocellular, and testicular cancer. Screening would not reduce mortality. So this was a USA study. The implications on oncology advanced practice nurses. The role of advanced practice nurses encompasses cancer risk reduction, screening and early detection. Oncology APN are able to assess, able to evaluate, able to interpret cancer risk assessment and recommend appropriate interventions. In India, cancer leaves a major burden on the lives of people and society. A report from Cancer Statistics 2020 among men, the projected incidence was 94.1 per 1 lakh individuals. And for women, it was 103.6 per 1 lakh individuals. 5 leading sites of diseases being breast cancer, lung cancer, mouth cancer, cancer cervix, uterine cancer, and tongue cancer. The emergence of the ongoing coronavirus pandemic has interrupted cancer care by delaying and reducing the cancer screening, diagnosis, and treatment, not only in country but across the globe. An effective cancer awareness campaign should be. So whenever we are taking any sort of cancer awareness campaign, the points should include are well-researched and high impetus on set goals. Audience of the campaign should be identified and defined. Craft a catchy tagline for your cancer awareness program. It should sum up the whole program. Engage ambassadors to reach out to larger audience. Celebrity cancer survivors should be an ideal choice. Launch the awareness program on a significant day. Any particular day having more significance is we can choose. Creating a web page is a must when our life has all become digital. But overcoming distrust is still a barrier. One should have faith. So overcoming distrust is still a barrier. In India, that came forward for not screening are no symptoms, then why screening? We are not having any symptoms, then why screening? Number 2, scared of test. They assume it painful. We cannot go. It is painful. The third, opting for screening would spread cancer more. If we are going for screening, then cancer will spread more. Financial burden is one important factor and time scarcity. So cancer screening is to see for cancer before the patient has any symptoms. Screening tests include the following: the physical exam history, laboratory test, imaging procedures, genetic test. Screening tests have their own risk. Some can cause serious problems. For example, large colon, the sigmoidoscopy, we are doing some. So rarely it can happen, the perforation of the colon can take place like that. So serious problems, for example, this is example. And false positive tests are possible. False negative tests are possible. Finding the cancer may not improve the person's health. or help the person live longer. You see, these are the screening test risks. Now, cancer screening is to see for cancer before the patient has any symptoms. Screening test includes physical examination history, lab test, imaging procedure, genetic test, and screening test has many goals. So, by screening test, we find cancer before the symptoms appear. Easier to treat and cure when found early. Has false negative and false positive test. Decreases chance of dying from cancer. Screening tests are not meant to diagnose cancer. More tests are required. This is one part of the ladder. So further steps are there to go. Now, concluding with this last slide, I'm very thankful to Honorable Chancellor Shri M.K. Rajgopalan, Chancellor Shri Balaji Vidyapith, and Professor S.C. Parija sir, Honorable Vice Chancellor, and Moderator Professor Janet Berlin for giving me this opportunity. And a big thanks to all the viewers online mode. Thank you very much.
Thank you, madam. You have guided us through cancer awareness. You have also said that cancer awareness is a key to early detection and better health-seeking behavior. And you have enlightened on the positive association between awareness, curability. You have listed the risk factors, the necessity of the awareness towards cancer approach, and how cancer can be prevented if it is going to be a viral or bacterial factor. And you also said about APN, that is Advanced Practice Nursing. You also said about primary prevention, chemo prevention, modifiable risk factors, irreversible risk factors, etc. And finally, you also touched the screening test, the goals of screening tests, etc. And thank you on highlighting on overcoming the distress using due to cancer. Thank you so much. It was a wonderful session, madam. If there are any queries, it can be typed into the chat box. It will be answered to your mail. Now over to the second session. It is my honor and privilege to introduce my Vice Chancellor, Dr. Subhash Chandra Parija. Sir is an eminent academician, erudite microbiologist, researcher, keen votary of medical education, and an able administrator. Sir was the formal director of JIPMER Pondicherry. Sir has authored 16 books and has more than 400 research papers in national and international journals. Sir has been listed among the top 2% scientists globally in the field of tropical medicine. Sir is also the FAO WHO expert member on foodborne parasitic diseases. Sir has received the highest Dr. B.C. Roy National Award by MCI in the year 2003 for his noble contribution to the development of medical microbiology. Sir is also the founder of Indian Academy of Tropical Medicine. Sir has been confirmed with various fellowships that include FAMS, FACAI, FABM, FIMSA, etc. And Sir has recently been awarded with S.N. Bose Birth Centenary Award for the period of 2020 to 2023 for his immense contribution in the area of molecular parasitology, parasite serology, and immunology, epidemiology, and parasitic diseases. Over to you, sir. Thank you.
Thank you very much, Professor Janet, for introductions. At the outset, it is my immense pleasure and privilege to extend a hearty welcome on behalf of our big family of Sri Balaji Vidyapith, popularly referred to as SBV, and on behalf of our Chancellor, C.M.K. Rajgopalan, and on my behalf, to distinguished speakers and members of the audience. It's my immense pleasure to thank immensely our distinguished speaker, Professor Neelam Mishra, Vice Chancellor, Krishna Vishwavidyapith, Karad, Maharashtra, for her gracious presence and sharing a lot of thoughts on these various aspects of cancer awareness programs and attitude toward the cancer screening programs. It has now made my job only very easier. Now, what I'm going to share with all of you is about two important components extension of what Professor Nilima Mishra mentions, that is about the cancer awareness programs, in particularly with the efforts of the governments of India. And having told that, I summarize about the various self-examination practices that are available, which can be performed and carried out by the public in large. Is it my slide is visual, Dr. Janet?
Sir, it is visible, sir.
It is moving forward?
Yes, sir.
Okay, thank, that's great. So this, my talk will be on cancer awareness and self-examination practice among the general public, because as Professor Nilima Mishra has rightly mentioned, one of the very most important component of cancer prevention is by self-public, so by examinations, and that includes self-examination practices. So we all know, just I'll brief about what is neoplasm, that's cancer. As you understand, it is an abnormal mass of tissue, the growth of which exceeds that of normal tissues. Moreover, this neoplasm is synonymous with rapid growth, continuous growth, a characteristic of cancers. There are wide statistics that are available about that reflects the seriousness of these cancers. Lot of statistics. It causes 20% of our deaths. Every year, 8 lakh new cases are detected. And unfortunately, in India, nearly 5.5 lakh cancer patients dies. And this is not only for India, it is the leading cause of death worldwide, accounting for nearly 10 million deaths in the year 2020. It's a great number. And as Professor Mishra has nicely mentioned, the most common causes of cancer are that of breast, lung, colon, and rectum, and particularly in males, prostate. And as he has mentioned about that many causes of cancer death are due to tobacco use, high body index, alcohol consumptions, and so on very nicely. I'm not going to repeat all those things. But one of the things that is most important, and we have to share a message that many cancers can be cured if detected early and treated effectively and aggressively. I think this is the most important basis of cancer prevention awareness. And when we think about different causes of cancers, this is sporadic, 70 to 80%, and 15 to 20% are showing the family clusters. And cancers, suppose one goes on smoking, what are the cancers one can get? It starts from varieties of cancers, starting from the cancer of the lung, that is 78%, one of the highest cancer that can be associated with smoking, and also in addition to the other unusual sites like pancreas, mouth, and stomachs. And also alcohol. Alcohol, there are 4 ways alcohol causes cancers. It causes damaged cells, increases damage from tobacco, affects hormones, links to breast cancer, breaks down into cancer-causing chemicals. That is why it has been suggested widely, if one stops drinking alcohol, drinking less alcohol could prevent 12,800 cancer cases per year in the UK. If one has to analyze similar statistics in the different parts of the globe, the statistics should be more or less says. Here's what it means. Alcohol is one of the leading cause habits. If it can be controlled, it can give rise to less number of cancers. And of course, there has been a lot of studies which has been shown the risk for is obesity and overweight. That is like esophageal cancers, gallbladder cancers, endometrial cancer, and so on. And there are throat cancers, various cancers of all those prostate cancers already has been detailed. I won't repeat it. But what I like to say my thoughts is that, what is cancer awareness measures? What do you mean by cancer awareness measures? Cancer awareness measures, it refers to questionnaires designed to measure awareness of the symptoms and risk factor of cancer, besides addressing the barrier to seeking help. It's very interesting to note an interesting study which was just shared by Professor Mishra about this questionnaire-based surveys among 198 nearly school teachers that speaks about various rates of cancer. This is an example that basis of cancer awareness measures. Now the question is that why there is a need for cancer awareness? Why should be so much aware of the cancer awareness? Because the major objective is to help enhance the awareness about the disease and more significantly to reduce, to diminish or attenuate the social stigma associated with cancer. Unfortunately, the social stigma attached with the cancer is more prevalent in the comparative low-income countries and developing countries than higher developed countries. Now, in this context, in this background, let's analyze some of the factors that in Indian scenarios. In Indian scenario, is characterized by many components. Is general awareness of the cancer is definitely poor, and particularly the awareness of the cancer, especially on cancer curability and prevention, is very poor. Still, people believe cancer is not curable, not preventable. These are the major gaps. Hence, there should be awareness about the risk factor of cancer, largely limited to tobacco and alcohol consumptions. There is a strong awareness, the linkage of tobacco and alcohol consumptions to the different cancers. But of course, there has been increased better attitude towards screening modality has been found to be good among the Indian population. They understand the importance of this screening test. However, this screening practice is poor. Although they understand screening can reduce and can be of value, but nevertheless, when they implement it, screening by patient themselves or the person themselves is relatively poor. Hence, in this scenario, one must emphasize strongly that screening practices which are largely available and simple, particularly personal screening methods, can be improved by definitely creating high level of community level awareness. If there is an increase of high level of community awareness, the screening procedures will definitely contribute to a large extent for awareness and better prevention of the disease. And there are various factors about awareness. Awareness about the common cancers. What are the common cancers that came to? Awareness about the source of cancer information, where one can get the information. Awareness about the risk factors that promote cancers so that people can be careful for that. And awareness about the signs of cancers, about preventability and curability of the cancers. These are different components of awareness, pertaining to the source, pertaining to the curability, pertaining to the preventability, and so on. Hence, awareness and attitude to screening and prevalence screening practice is multi-componental. In this context, there are many solution approaches that can be done to implement, increase cancer awareness. First and foremost, to educate the public, people, about the cardinal risk factors of cancer, either breast cancer, prostate cancer, cervical cancer, lung cancer, tongue cancer, so on. Because it's clearly proved, established that more than 30% of cancer cases could be prevented by suitable lifestyle modification, just what Professor Mishra mentioned. Hence, to apprise the general public of the significance of the regular screening, that is the most important take-home message to be given for prevention. And obviously, in the 4th February every year, we celebrate World Cancer Day. And now, when we'll analyze that the statistics of the cancer is increasing, is because the increased cases of cancer, it's due to multifactorial. Is cancer incidence is increasing because of 3 important components. First is awareness is increasing, and diagnostic facilities are increasing. So in essence, more and more cases of cancers are detected. And second is for early detections. All these factors have definitely contributed to incidence of cancer in thereby. Now, with this cancer incidence and awareness, we'll just share some of the slides on what are the cancer screening procedures that are being carried in both men and women. For example, in lung cancer in men, CT scan every year in short and long term, those who are chronic smokers, heavy smokers, 55 to 80 will be of valuable. Similarly, it's been suggested colonoscopy at least once in 10 years or other tests more often in men and women that can be helped to screen for the cases of colon cancer. But as Professor Misra has rightly mentioned, screening cancers are not confirmatory. More of these scans and other specific tests to be diagnosed, and prostate cancers. This is, of course, there is a lot of controversy about the PSA test. One should be careful about the interpretation of the PSA about in mean 50 to 74. And same thing holds in breast cancers, particularly been suggested mammography every 2 years, women of 50 to 74 years would be of value of screening the breast cancers. Now, these are some of the common symptoms of lung cancers, starting come to persistent cough, short breath, and but signs of breast cancers are varied. That's what I'm not going to tell in detail, but there are some of the specific points that can help in the demonstration of the breast cancer or the lung cancers, like constant pain in breast or armpit, inverted pull, nipple, changes in its position and shape, and changes in its stressors are the common factors. Then, in that case, how to do a breast self-examination in 6 tests. These are the recommended procedures, what is being suggested. 6-step methods of breast examination. At least do once a month, a week after your period. Second, look in the mirror for any asymmetries. Third, touch all portions of the breast up and down, left to right. Start feeling for lumps or masses. The main objective is to note any lumps or masses. Check from the under area to the chest wall and sternum, and conduct the self-examination standing up or lying down. These are the standard accepted practice that helps to detect to note and change by self-examination. Similarly, many methods are being suggested. What are the self-examination methods for skin cancers? One is examine your moles using the asymmetry, if there, border of the moles, color of the moles, diameter of the moles, evolution of the moles. That could suggest some idea about the skin cancer. Similarly, there are screening methods have been suggested, like oral cancer screening of examining gingiva, mucosa, lip, buccal mucosa, vestibule, floor of the mouth, lateral border of the tongue, and so on. And particularly for the prostate cancer, and the testicular cancer awareness that is promoted by Testicular Cancer Awareness Foundations. Examine one testicle at a time using both hands and try to detect any lumps or change in size or irregularities. It is normal for one testis to be slightly larger than the other. In essence, what we like to emphasize, there are various standard practices that are available. They're simple and can be done by self with a little of training and motivations. Because as we have been clearly mentioning here, that early detection is the better, and that gives for better chance of prognosis of the cancers. And preventive measures like importance of dietary fibers, awareness on and intake of dietary fibers should increase, because dietary fiber decreases the risk of colorectal cancer by enhancing stool bulk, modulates the transit time, decreases the contact between carcinogens and the lining of the colorectums. But there are many barriers in the cancer care. This includes gender discriminations. It includes socioeconomic status and poverty. People difficult to afford the expensive treatments, and obviously age discriminations. So there are a lot of programs under the National Health Mission have been started for prevention and control of cancer, diabetes, that's non-communicable disease. As part of comprehensive primary health care, persons more than 30 years of age are targeted for screening of the 3 common cancers, namely oral, breast, and cervix cancers. Screening of cancer is an integral part of the service delivery under the Ayushman Bharat Health and Wellness Centers. Government of India's initiatives on creating cancer awareness and promoting self-examination practice among the common public, that is one of the most important area of thrust that is being given, particularly on self-examination practice for early detection of the cancers. Because in essence, what we should understand, cancer is preventable if we improve our lifestyle and lifestyle. Cancer is curable if detected early and treated promptly. Hence, for detection, early detection, the most important component contribution is self-examination practice for different types of cancer, either breast cancer, skin cancer, or the prostate cancer, and so on. And most important message is take-home message that, of course, cancer can be treatable at any stage with our available facilities. Thank you. Thank you very much for your special hearing. Thank you so much.
Thank you, sir, for the wonderful talk as usual. You have enlightened us with the statistics of cancer in India, its causative agent. Then you have asked, you have highlighted us the importance of what is cancer awareness and why cancer awareness is important. And you have also highlighted about the Indian scenario of how important is cancer screening practices. And to highlight, you have also said why the cancer incidents are increasing in the recent eras. And you also said the answer will be like, it is due to increased awareness, increase in diagnostic facilities, and increase in early detection procedures. Thank you for enlightening us on the 6-step breast self-examination method, 8-step oral cancer self-examination methods, 4-step testicular cancer evaluation method. You also spoke about the barriers in cancer care, and you also highlighted on the national programs which are initiated by the Government of India. And thank you for emphasizing on cancer is curable, preventable, and it is also treatable. Dear participants, at the start of this program, I would have told you there are certain myth with this cancer. To mention it again, I told cancer means death. So both these speakers have beautifully enlightened, and they have told, no, cancer is not the terminal illness, it can be treated. And the second myth was, cancer treatment is very costly, it is not affordable by the public, and it is very painful. And I must say, by the government initiative, it is not so. It's affordable for all, and cancer is generally thought by the public that it can never be cured, or it reappears after treatment. And it is very clear after this talks that cancer is curable and the treatment is very effective, that it may not reappear. And the general public also think that all cancers are the same. Now, emphasis has been thrown on these points by both the speakers, and they very well highlighted that cancer has multiple dimensions and multiple causes. So not all cancers are the same. And finally, it is among the general public that they think cancer is contagious. Please take this myth off. It is not so. Cancer is not contagious. Thank you for both the speakers for highlighting us on cancer awareness program, self-screening, etc. Thank you so much. I have a few words to say at the end. The webinar series, which started almost 3 years back, has been very successfully running for 35 episodes every month, Wednesday, on the third Wednesday. This is a brainchild of our Vice Chancellor, Dr. Subhash Chandra Parija. I must thank our registrar, the man behind all the success, Dr. A.R. Srinivasan sir. Thank you, sir, for giving us this responsibility to take up this job and finish it successfully. I must thank two of my co-workers, I would say, like my friends, Ms. Sherin and Ms. Janita. They have been very supportable for me throughout this webinar series. And thanks to Praveen, the IT support. Thank you all. We will meet in another forum. Thank you so much.
Thank you very much. Can I have options to just give my concluding note? I must take this opportunity thanking you. Thank you, Professor Neelam Misra. And I see a lot of your staff from your esteemed institute has been participating. It encourages, motivates us. This reminds me my interesting my visit to your prestigious institute as part of one of my professional assignment. I enjoyed that visit, and really it was such an interesting and development of eminence of your institute that we're progressing very fast under your able guidance and leadership, Dr. Neela Mishra. I'm so happy that you are with us, and I wish that your universities and your staff member please continues to patronage our webinar series that's being held every third Wednesday of every month, and we learn from each other's experience and share. Thank you very much. We'll miss some of that. Thank you so much.
Thank you very much, sir. Dr. Parijat, sir,
Thank you.
and our Janet, sir,
Thank
my
you.
all respected dean institutions, Vaishali,
Thank
and
you,
all my Karad, mera staff, everyone. I thank you very much.
Thank you.
Thank you.
Everyone
Can
is
I have
there.
one
I can
question,
see.
sir?
Yes,
Thank
please.
you.
Yes, please.
Sir, it was an excellent presentation. Thank you for giving us the opportunity. But I have to ask, I have to clarify one question. Since we are, Chancellor sir is conducting the awareness program, it's a big campaign since long years. And we have reached up to 10,000 women for the awareness program. And what we found is women are very conservative. And we have a device like a handheld device, intelligent breast device. And we have screened 2,500 cases. We have found 177 irregularities and 4 malignant cases. But as madam has explained and stressed upon the advanced nurse practitioner's role, it is very good, madam. Thank you for that. And but if it is we are planning to include in the nursing curriculum as a screening and awareness, this one for early detection, and it helps for downstaging of the cancer. But what I feel that some extramural funding if we get our undergraduate students, so that can be we can take it ahead as
Of course, madam. Of
practice.
course, our Dr. Bhosle is always there for this. No need to worry.
Thank you, madam.
Thank you, sir. Thank you, madam. A very nice cancer awareness program and very well spoken, madam and sir. Thank you so much.
Sir, he is our registrar, Dr. Ghorpade, sir. Dr. Mukund
Yes,
Ghorpade.
sir. Yes, sir.
Thank you.
Thank you,
Thank you, sir. Thank you.
And my all deans are there, sir. My dean academics are there. My all 6 deans are there, sir. Everyone is there.
Thank you, madam. Thank you for the opportunity.
Thank you. Thank you. Thanks a lot.